Hello.
First of all, I have to move my muscles a little bit. Sitting out there kind of make me kick my face all the time. So. My name is Alberon Gundim. As they call me at work, you can call me Alvin, Albert, anything. That's how they call me at work. They never get my name right, so they call me Al most of the time. I work for Lahey Clinic, also called Lahey Health, and they would have changed the name. And I'm a medical assistant there. It's been 4 years and about 7 months that I have been hired by Lahey. They bought me from American Personnel, which is a temporary positions that you can work. I probably served about 10 different locations at Lahey for American Personnel. Do I look nervous? No. There's way too many beautiful people. It's time for me. So when I finally applied for Lahey, I found out that American Personnel kind of owned me a little bit, which was fine. They were very nice to me. But Lahey bought me. That was a perfect situation. I started working for Lahey, and since then I've been working for Lahey. They are very faithful to me. I'm very faithful to them. We're a great team together. And I also want to thank Karen for the opportunity of speaking here to such a great people, great crowd. I want to thank Ann Piet and also Michelle Maiden, which are here with me. They are the educators for Lahey, nurses and medical assistant educators. And I want to speak a little bit about, let me speak about what I do first. Long time ago, I worked as a billing coder for a practice that only worked for physical therapy. I didn't like the job much. Dealing with insurance personally, it's very tough work. I don't know if anybody here have done that before. You have to get paid, and you know how easy it is to get paid. So I then applied to work in a bank. I worked for a while in a bank, Bank of America, and then after that I worked for something called the U.S. Department of Commerce and Statistics, which does the census every 10 years. You guys are familiar with us knocking on your door and ask how many people live in your house. So I didn't knock on anybody's door. What I did is I actually followed the people who knocked on the door. It was called the quality control team. And I was watching them if they were actually knocking on people's door, just pretending that they were doing their job. So I was the villain. I was the bad one. But people did a very good job. The job was done. This was a temporary position. And after that, I decided that I want to be something else in my life, something that could guarantee my kids the future. I don't have kids. I just have one daughter, but who knows. So what happened is I went to medical assistant school because this was the quickest and the best way to get into the medical field. I went to Lincoln Tech, and I don't know if anybody's familiar with the program. They have a very intensive, good 10 months program. And after that, I served as an externship at Mass General for 6 weeks. And after that, I started working for American Personnel. So I kind of like met a lot of nice people out there, Mass General, about 10 different locations at Lahey. And now I'm working for Arlington site at Lahey. We have a very nice group of medical assistants over there, very, very unified, powerful. And it's a group of people that work, and I'm very pleased. I just want to let you guys know that it's a very, very honoring position to be a medical assistant. All right? So let's talk about what changed. So let's go right here. Oh, I want to mention that too, that I am now enrolled to become a RN at Middlesex. That was my goal, right? I love that, thank you. So let's talk about the training. The training that Lahey provided was very nice. The way that they divided the training made it easy for the medical assistants and the managers at the sites to kind of send everybody for the training. One of the ways was 8 hours section, which actually it was not the full 8 hours. We had the breaks and we had the lunch time, but it was enough to get 40 hours for the training total. So they divided by 4 modules, A and B. gave us a whole year to do this training. So you could kind of go and book the day you want to show up for your training, and then everybody could go, not everybody at the same time, throughout the whole year. And we spent the whole day only on the training. So we stopped several times, have our breaks. It was a lot of hands-on, and it was a very, very nice training. We had about, I would say maybe like 7 or 8 brochures that we took home. I still have mine that I keep in my job in case I need to refresh or something. We talk about asthma, COPDs, diabetes, PCMH, which I think it's the vogue of the town, PCMH. We are all trying to get into this program. It's very nice. I would like to be treated by a PCMH team, because I know I'll be the center, you know? Arthritis, heart disease, stroke, obesity, hypertension, depression, which is very important to talk to about depression. You never know why the patients are looking so sad, and sometimes you just don't pay attention to that detail. So depression is very important. And then insurance coverage. We know we all need to get paid, right? So we met at Lahey specific places. They had different offices set up in different locations. And I'm just talking about this so you guys understand the way Lahey did it. And you could kind of choose whatever was closer to your house, since you're going to drive directly to the meeting and then come back to your home. You don't have to show up at work that day. We all like that, by the way. Thanks, Lahey. And we had 2 instructors, Patrick and Kristen. They were very nice people. They're very good instructors. So I'm going to talk about my experience at the training, how I felt about everything. So is that okay if I read? Yeah. Thank you. So, in my opinion, this was a superior training. Good updated material, which we still use it day by day. If I have any questions, I'll just go back to my material. We learned how to improve the quality of our service and time management. We know we all do a good job, but sometimes you have always a little room to improve. Since I started working as a medical assistant, I had this conception that the quicker, the better. I don't know if you, is there any doctor here? So basically it's most managers. Is any manager? You know? Yeah, nurses? Perfect. So I always had that conception, get the patient in quickly as possible, get the patient out. And that was my conception until I had this PCMH training. I learned that not only the time, but the quality of my service delivered to those patients will improve the doctor care. I once mentioned to Kristen, one of our PCMH instructors, that I would start getting nervous every time I thought I was spending too much time in the room with the patient. I believe that the new settings we were performing during vital signs would take an excessive amount of time and would interrupt the doctor time with the patient. This was my opinion. Okay, we're doing way too much. Why do we have to check temperature every time? They don't even look like they have a fever. And this was my conception. I better just get in and get out. Let's see. So then she explained to me how beneficial it would be for the doctor coming into the exam room and find that patient completely viral. Everything done for that patient. How much time it would save for the doctor himself. This would facilitate the doctor's service and decrease the amount of work he would have to perform himself. The new set of thoughts helped me to develop a better attitude about my time management and the quality of my service. I enjoy every class section. The amount of information we learned and refreshed our knowledge improved and developed new skills that I am still utilizing daily. Kristen and Patrick, the instructors, reviewed all the material necessary for our roles. They spoke about OSHA, HIPAA, patient and colleague safety, lab tests, clinic perform tests. They steps in performing those tests, such as urine pregnancy, for example, peak flow, glucose, finger stick, and all other tests that we perform in the site. So we went through those either by slides, and also we did some hands-on during those training. We learned about cardiovascular disease, asthma, COPD, hypertension, depression. We learned new concepts and also had material refreshing regarding chronic disease, diabetes, obesity, arthritis, cancer, heart disease, stroke. And this was all explained in details. So So we spent a lot of time on those. An entire class was dedicated to the chronic condition material, which I thought was very interesting and important because we deal with a lot of those conditions nowadays. Moving on. What was the most worthwhile part of the training, in my opinion? Okay, the refreshing of our knowledge. We all learned something at some point at medical assistant school, but since we don't use it all the time, those things start getting put on the side. And may acquire a lot of information during that main school, but not always utilize what we learned. In those trainings, we were encouraged to use all of our skills, all of them. We practiced them in class. Plus, we were taught the update and most effective way to use them. You guys know how the guidelines always change. Oh, this time it's 130 over 80 for blood pressure. Next year it's 140 over 90, and then who knows what next year will be. So it's good to keep it updated. I was always concerned about getting the doctor in the room as fast as possible. My main focus was time, as I mentioned before. My confidence level has increased after the intensive training, which I can easily tell had a positive effect between the patients, the doctor, and myself. I guess the doctors become a lot more trusting and confident about that medical assistant being trained before working for him. I also feel great working with other medical assistants, knowing that they have the same training. I mean, we're on the same page. We share the same knowledge. It's important to have everybody with the same type of training, especially when I don't want to just go and talk to someone about something and they have no idea what I'm talking about, or vice versa. So it's good to have that. It's a win-win situation, and employers like Lahey, for example, that invest in employees will always have a positive outcome. We already heard other people talking about it. The training is crucial and the key for the success. The old saying, right? Practice makes perfection. But it only happens when it's done the right way. The medical field is under constant development, and staying behind is not the optimal choice. Training classes, like the patient-centered medical home, will increase the knowledge of the medical assistant staff. We know that not all the medical assistant schools will cover the same material, but you will know that your medical assistant know what they're doing when you cover the material yourself. After the training, the medical assistants became more familiar to the patients. I think it was maybe Alyssa who spoke about everybody's a nurse at the practice. That is a true story. I have been called nurse since like 5 years ago. And I tried to explain the difference. Since we had this training, this kind of shifted a little bit. The idea shifted. Now that they come in and they say, oh, my MA, and they say my nurse. So they kind of like learned that nurses do something different, or maybe they can do the same thing, but they are somebody else different from what we do, the medical assistants. So that kind of helped to make that foundation. And the reason is we are now working more directly with them. I kind of can call them and let them know their prescriptions are signed and ready to be picked up, for example. I mass spec them myself, which is checking how they are with the constancy with the same pharmacy, not getting prescriptions filled twice for an opioid, for example. We also queued the prescriptions to the doctor, which we didn't do before. We don't approve them, but we can submit the request for the doctor saying that the patient have requested that. So we have been doing so many more stuff that we didn't do in the past. It's been granted this favor to the medical assistants, which we love doing it. We like to use our skills, and we're kind of like, hey, I have Kristen right there. Guys, this is Kristen. I only speak great things about you, so
thank you.
Okay.
You're doing great then. Go ahead. I'm just checking, making sure, you know.
She's a very good one. So we have been using a lot of this lately. I am very happy about this change. I always felt like I could offer more, but I was kind of like hold back. Now that we have been trained and trusted, I kind of feel like we've been doing this, and this is a very good step. So let's talk about the impact on the patient care. First thing that we learned, and Kristen and Patrick was very picky on that part, was customer service. Because our patients are also our customers. They're not just patients, they're people who are sick, and they're seeking for help. And this is a big hit. the verbal communication, the non-verbal communication, as I said, my muscles were hard, because if I sit there and I just let them relax, nobody would like to look at me. So the verbal communication is very important. The way you talk to the patients, we should smile, yes you should, but be careful. Somebody just lost their father this morning, you just come in and say, hi, how are you today? I'm a medical assistant. No, you gotta be compassionate. You have to have passion for that patient. So watch your verbal communication. They talked about it many times, the way you treat the patients professionally, respectfully, and as a friend, as a family. That's how I believe everybody here who works in the medical field, and that includes me, would like to go to a place that they will treat you with a lot of respect. Is that right? I guess the patients feel the same way. So it was a very worthwhile and important learning about this communication skills, customer service. We all learned clinical skills that we didn't utilize before, we've been utilizing right now. And the medical field depends on the correct communication that I spoke about there, and error can happen easily. An error can happen easily. So having a group communicating is very important, knowing that there's somebody else already working on that situation, so not two people will queue the same medication to the doctor, or something like that would happen like this. They also emphasize about informing patients on their time. So patients sit there in the waiting room, the doctor is running late, and they would be okay if you walk to them and say, you know what, your doctor's running about 25 minutes late, I'll come back in 10 minutes if he's not ready, and I'll let you know the next update. So they kind of feel like they have not been forgotten. They know they are there, but they're just not like a person sitting there. They are important. We also talk about active listening. For example, right now everybody's doing a very nice active listening. Nobody's talking, nobody's doing anything, so I feel nice about it. So if the patient is talking to us, as we were instructed in those CMH training, you listen to them. You don't just go like, so are you feeling any pain today? Yes, I'm feeling any pain. What's the location of your pain? Oh, it's under my hips, and I'm pretending like I'm just interested in getting that information in the computer, but not actually listen to what the patient has to say. I once, and this is a very nice example, before all this going on, all the training, I had a patient who told me she had a pain, a very much aggravated pain on her neck, and it was fibromyalgia. Can somebody say it for me? Thank you. And she said that the pain was excruciating, and she was about to cry. And I said, oh, okay, and from 0 to 10, and she was like, I'm gonna say about 8, maybe 9, and I was typing, and then she looked at me, and that was a good lesson, and she said, you don't look like you care. Maybe I didn't, but she didn't have to know about that, right? I could have done them a lot better. I could have said, oh, I'm sorry you're going through this pain, and maybe she meant it, that I didn't really care. Because she was suffering, and she said, it's been about 3 months, I can't sleep, I can't walk, I can't do anything, even my husband is complaining. So she wants somebody to care, and I learned on that training that if you listen, people will get a lot more appreciated. Isn't that right? So we also talked about AIDET. You guys are familiar with AIDET, right? Acknowledge, introduce, duration, explanation, and thank you. And we have been applying this very diligently. Okay, don't worry about it. Don't worry about it. That works. Diligently. I guess that's how you say it. All right. So on the training process, we mixed our groups. So there were people from Arlington, and this is within Lahey. We had people from Lexington, from Amesbury, from all those places, and this was a great experience. I had no idea how they worked in different locations, how they go through their day, what happened to them. And as the class, we had 8 hours to spare. I mean, I guess it was 8 classes, 5 hours would cover it. But we had this whole day to spare and talk and had a great time, and it was pretty good. So we had a talk. It was very nice. I got to meet a lot of other people. They met me, and they will never forget me, I promise you. because I am weird. So, and this was pretty good. I mean, we got to meet each other, learn what each other does at different sites. Believe it or not, within Lahey itself, we had so much differences going on, which now, I guess, got unified after this training. What it's not unified yet, it's working towards getting one standard situation. So we had a full day of training, as I said, and this was pretty good. By the end of the quiz, by the end of the test, or the class, we had a quiz. They were not easy on us, by the way. That was like a long quiz, but they want to know if you were fine. We tested out of it, it was perfect, and it was very good. Thanks, Kristen. So one more thing. Any questions? Thanks. Oh, no. Go ahead.
Working with the other partners, did they express concerns about having to push up, that you were doing all this training and you were coming back and doing this model, but was there buy-in from the top down? Was there buy-in from the physician? And do you all feel comfortable about what you were doing and going back and doing it?
Yes, so no, not everybody felt confident, of course. Not everybody felt good about it. Some people, there's always the ones that say, this is not for me. Of course, there's always the ones who are going to say, but the majority of the medical assistants that were trained like the idea. I, for example, was completely excited about it. I mean, you guys can tell. I like the PCMH. And of course, not everybody agreed. Some people were just like, I'll use like a street word, they were just troubled, you know. They don't want it, they don't think it's worth it, but the majority thought this was a great idea. And we spoke about this many times, like in class, the instructors, they always told us, if you don't learn, if you don't update, if you don't upgrade, you can't win. I mean, you can't not stay in the field, because the field is always modifying. So I guess this was your question?
No, it was if you were supported. You liked the training, you wanted to go back and implement it, but were you being supported with your peers and your superiors?
Yes. So, okay, the support part. Yes, we were, and then I'll and also say about something about it. We were very supportive. Managers were supportive. They want us to go. They were kind of looking at your schedule, make sure you're going through the modules, so the year would not end without you finishing your classes. They wanted to happen. The physicians wanted to happen. I spoke with my doctor himself, and he said, this is very good, because after this training, I will know that, he said, I already know you know what you're doing, but after this training, I know for sure that you at least refreshed on your ideas, on your knowledge. And this was, we were very supportive. Lahey was pro this. Lahey wanted this to happen.
And I do think that the MAs left the gate on this before a lot of the providers did it. So we are in the system's in the process of practice redesign, which includes all the staff. But I had kudos to the MAs. I think that they kind of left, they were out ahead of team-based training and so on before the providers. And yes, they embrace that and acknowledge it, but these guys really set the path, so it's great.
So two more comments, and then I'll sit. I'll take the microphone with me, because I have the microphone. So two more comments. One is, and this is a personal opinion, I'm a medical assistant. I'm still going to need 3 more years of school at least to become an RN. And one of those comments is, if I ever had to work in another facility, Lahey's been treating me pretty well. We're not gonna separate. No divorce going on. But if I ever had to work in another facility, I would feel confident to work for a facility that works with this type of training. I don't want to jump in and all of a sudden people are looking weird at me thinking, why is he doing that? So having everybody on the same page on the medical field, that would be very important. And the other thing that I heard so many times is that medical assistant is such a, we're going to compare the medical field as a car, so you guys can understand. And I think Kristen said that many times. And we are the wheels. The medical assistant is the wheels, the one that touch the ground. The grounds are the patient. The path is the patients. So you could have a very powerful, nice Corvette engine, a very nice engine, which are the doctors. Great management, which are the drivers. And then all the people work, the batteries and everything, nurses and practitioners, x-ray. And we are the wheels. Right? The medical assistants are the wheels. The thing is, no matter how nice your car look, how great and powerful your engine is, if the tires are not good enough, if they're not strong enough, if they're not prepared to face dirt, which is dirty paths, to face icy paths, which patients who are difficult, they're not going to go too far. They're not going to reach much of this road. So if you want to reach more road, you need a nice car with nice engine, but you need nice tires. So training us, it was a great idea, putting great tires ready for all seasons. All right? Thank you very much, guys.